Welcome back, my dear friends. Now, after completing about the foregut and the structures related to that one, like we have learned about development of liver, the development of pancreas and spleen, and we have even learned about the rotation of the foregut also, 90 degrees in clockwise. Now, let us move on to the next topic, that is midgut. Now, in midgut, my dear friends, remember, in midgut, first of all, try to understand the entire scenario here. What's happening? Now, first of all, this rotation of a gut, it's actually taking place at 6th week. Listen, like starting 5 minutes very carefully. There is like entire orientation that I'm trying to give you. In the midgut rotation, what is going to happen? The rotation is going to take place during the 6th week. Just try to get that timing in your mind. 6th week is very early during pregnancy. And during that 6th week, what will happen is that the size of the trunk of the embryo is very much smaller. The trunk of the embryo is very much smaller. And already we have learned in cardiovascular system embryology, heart is already formed in the first month itself, and even the liver is formed along with that one. So in the trunk already you have the heart formed as well as the liver present over there, and that will be already occupying the trunk. Perfect. And because it is already occupying the trunk over there, we don't have enough sufficient space to accommodate the long coils of midgut. Why? Because we all know what is midgut including. It will include your duodenum, jejunum, ileum, and all those jejunum and ileum and all, they'll be having like long coils. And during 6th week of the pregnancy, at that early during pregnancy, there is no enough space in the trunk to accommodate that midgut there. So therefore, what will happen is that midgut is going to herniate out. So via the umbilical opening, the midgut will come out, it will herniate out, and then it is going to rotate 270 degrees. And then what is going to happen is that it is going to regress back into the abdomen, reduce back into the abdomen simultaneously. So while rotating, it is going to simultaneously reduce back into the abdomen. Okay. So don't worry about like the entire rotation and all. I'll show you that in a separate video practically on my body. And then later on it will become like damn easy for you. So first of all, keeping this in the mind, let us try to write down the notes here. So for example, if this one is your midgut, midgut will actually herniate out via the umbilical opening. So imagine this one here to be your umbilical opening here. And via this umbilical opening, once the midgut is going to herniate out, then after coming out, what is going to happen? It is going to rotate 270 degrees in total in anti-clockwise direction. I already made you write down that one. Foregut is going to rotate 90 degrees in clockwise. Midgut will rotate 270 degrees in anti-clockwise, whereas hindgut is not going to rotate there. Now, the important thing is, if it is rotating around which axis? What is the axis of rotation? I hope you all remember, midgut is supplied by superior mesenteric artery. The artery of midgut will be the superior mesenteric artery. And superior mesenteric artery is the axis of rotation of midgut. So midgut is going to rotate around that superior mesenteric artery, guys. So superior mesenteric artery is the axis of rotation of the midgut. Now, why am I telling you about this artery right now? Why? Because there is some important role to play here. Whatever part of the midgut that you are able to see before that artery is referred to as the pre-arterial segment. So this one is actually referred to as the pre-arterial segment. This is pre-arterial segment. And the name is like very much meaningful there, guys. It is before the artery. And whatever the remaining segment that you are able to observe there, that is actually the post-arterial segment. Post-arterial segment. And one more thing I would like you to understand from here itself is that what is your entire midgut including? Midgut starts from your second part of the duodenum, to be more specific from the major duodenal papilla, the opening of the common bile duct and all. So from there, from the second part of duodenum, it will include the remaining duodenum, then jejunum, then ileum, cecum, ascending colon, and then right 2/3 or proximal 2/3 of the transverse colon. Fine. All this is included under the midgut, the small intestine as well as the large intestine part, not the entire one, a part of that. So remember, out of this pre-arterial segment and the post-arterial segment, pre-arterial segment is the one which is finally going to form, or it is the one which is going to become your future small intestine. So it is the one which is going to become the future small intestine. Whereas the post-arterial segment, it is the one which is going to become the future large intestine. Large intestine. Fine. So it means that the pre-arterial segment, it is the one which is going to form the remaining part of duodenum and that long coils of jejunum and ileum. Whereas the post-arterial segment is the one which is going to form that cecum and then appendix and then ascending colon and the transverse colon. So because of that reason, what will happen here, even the cecal bud and the appendicular bud, you will be able to appreciate here only. In this post-arterial segment, you will also have the cecal bud as well as the appendicular bud, which is going to form the cecum and appendix, obviously. So basically, I hope you got the idea here. I repeat once more, midgut is it will be actually having like long loops of the small intestine as well as the large intestine. And this all rotation is taking place during the 6th week of pregnancy. That is the reason why in the trunk, you don't have sufficient space to accommodate that midgut. That is the reason why the midgut is going to herniate out via the umbilical opening, and then it is going to rotate 270 degrees and simultaneously regress back into the abdomen also. And the axis of rotation will be the superior mesenteric artery. That is the reason why we can divide that into pre-arterial segment above and the post-arterial segment below. Now, if it is hernia, my dear friends, is it like pathological hernia or physiological hernia? Definitely it is physiological hernia. It's not like something pathology here. It's a physiological hernia. That is the reason why already this question has been tested in your exam. When will the physiological hernia occurs? So let us see the MCQs right now. So when will the physiological hernia occurs? Obviously, the physiological hernia will occur during the 6th week. Now, after that physiological hernia, what should happen? It is going to rotate and then again reduce back. And for all that, it will be taking almost like 4 weeks of time to complete. So therefore, when will be the reduction of physiological hernia will occur? Reduction of physiological hernia. That will be taking place by 10th week. So physiological hernia itself will occur by 6th week, and for all this to complete, it is going to reduce by 10th week, already asked in your exam. Now again the same thing, my dear friends, you and me, we are like very lucky people. Our midgut came out, rotated and went inside. Our abdomen perfect here. But in some unfortunate babies, what is going to happen? The physiological hernia will occur, but it will fail to reduce back into the abdomen. That all that loops of the intestine, they will fail to reduce back into the abdomen, and that baby will take birth with all that loops of intestines lying outside only, and that condition is said to be omphalocele. Okay, so let us just make a note of that one also over here. Anomalies are very much important here, guys, in the rotation of midgut. So if it occurs, failure of reduction of the physiological hernia occurs, if there is a failure of reduction of physiological hernia, then that condition is said to be omphalocele. Omphalocele, wherein you can see the baby taking birth with all that loops of intestine lying outside, and they're even covered by that sac, peritoneal sac, of course. Now here I have observed many of the students are getting confused with omphalocele and gastroschisis. See, it's very simple. Omphalocele is actually the failure of reduction of physiological hernia. Those loops of intestine did not go back into the abdomen. So that is the reason why they are even covered with the peritoneal sac. But when it comes to gastroschisis, in that it is not or nothing related to your physiological hernia. It's a defect in the anterior abdominal wall. It's a defect in the anterior abdominal wall. That's the reason why the loops of intestines will come out. So when the embryo is folding, when we studied about the folds of embryo folds like craniocaudally. Cranial end will fold as well as caudal end will fold. Not only the cranial and caudal end, even the lateral aspect. There will be lateral fold of the embryo. So if that lateral fold of the embryo is not completed, if there is a defect in the anterior abdominal wall, then the loops of intestines will come out. That condition is gastroschisis. So let me clarify once for all. Omphalocele is failure of a reduction of physiological hernia. The intestinal loops which came out, they are not going back into the abdomen. Whereas gastroschisis is actually a defect in the anterior abdominal wall, and that is why the loops of intestines will actually come out. There is a lot of difference between those two. And in omphalocele, what will happen? The loops of intestines are covered by peritoneal sac, and in gastroschisis, because it is defect here, there will be no peritoneal sac covering that one. So clear. Now once you are clear with this one here, let us do one thing. Let us understand the entire rotation of this midgut once very clearly with the help of a video that I am going to show you practically. And once you understand that in the video there, then we'll do one thing, we'll just come back and write down or register that in our books, guys, because practically it is understood very clearly rather than just writing. So just watch this video and get back, and then we'll write down in the notes, guys. So now after watching that video, I hope you have understood how the rotation of midgut is going to take place. The first 90 degrees anti-clockwise, the second 90 degrees again anti-clockwise, and third 90 degrees anti-clockwise. So whatever we have seen there, let us exactly write down in our books right now. So my dear friends, the first rotation, how much exactly is the first rotation? The first rotation will take place for 90 degrees in the anti-clockwise direction. Perfect. Now every time what we have to do is we need to always learn how much is that rotation exactly, and then what is the result of that. Because of that rotation, what happened? Now what is the result of the first 90 degrees rotation? I hope you have seen that very clearly. In the first 90 degrees anti-clockwise rotation, the pre-arterial segment will come towards the right, and whereas the post-arterial segment will be coming towards the left. So first 90 degrees anti-clockwise rotation, pre-arterial segment will move towards right, whereas the post-arterial segment will move towards the left. The post-arterial segment will move towards left. That's the result of the first 90 degrees rotation anti-clockwise. And not only this terminology, sir, that is like pre-arterial segment towards the right and post-arterial segment towards the left. Not only this terminology, I want already you people to develop the idea in your mind that pre-arterial segment is the one which is going to form small intestine. So the loops of small intestine will be coming towards the right. And post-arterial segment is the one which is going to form large intestine, and that is coming towards the left side. So pre-arterial towards the right, that's nothing but small intestine, and post-arterial towards the left, that's going to form your large intestine. Now once you are done with the first rotation, what about the second rotation? Second rotation will also occur for 90 degrees, and that too in the anti-clockwise direction. Second rotation will also occur for 90 degrees in anti-clockwise direction. Now again the same thing, we need to see what is the result of this one. Now I have shown you in the video very clearly, during that second 90 degrees rotation, second 90 degrees anti-clockwise rotation, it's not only rotating 90 degrees anti-clockwise, at the same time simultaneously it's returning back or reducing back into the abdomen. And what is the first thing to return back? Is it pre-arterial or post-arterial? Pre-arterial. So pre-arterial segment will reduce back, overlapped by the post-arterial segment. There is a large intestine, which is very much evident even in the gross anatomy. Right now in your body and my body, small intestine is overlapping the large intestine. And the most important feature in the second rotation is the midline cecum. The cecum is coming in the midline. Let's register that in our books. So what is the result of second rotation? Finally, what is happening here? The pre-arterial segment is overlapped by post-arterial segment. Pre-arterial segment is overlapped by post-arterial segment. You just keep that gross anatomy in your mind. Small intestine is overlapped by large intestine. That is your transverse colon here. And one more important thing is the midline cecum. The midline cecum. Cecum will be in the midline. That completes your second rotation. That is the end result of that. Now we'll come to the third rotation. The third rotation is again for how much? 90 degrees, and again it will be anti-clockwise. Now in this third rotation, what is going to happen? In this third rotation, 90 degrees anti-clockwise, what is going to happen? That midline cecum, because of further 90 degrees rotation in anti-clockwise, the midline cecum will be actually coming below the liver. That is the reason why it is known as the subhepatic cecum, or subpyloric cecum. Subhepatic or a subpyloric cecum. Because of that 90 degrees anti-clockwise rotation, that cecum will be coming below the liver. Now after that further, what is going to happen? Is our cecum present right now below the liver here? Absolutely no. Now that cecum from the subhepatic region, it has to go down into the right iliac fossa. Now how it is going down in the right iliac fossa, it's not due to actually the rotation there, it's due to the differential growth of the posterior abdominal wall. So the posterior abdominal wall, okay, will be growing faster there and taking that into the right iliac fossa. So because of differential growth of the posterior abdominal wall, okay, so the right subhepatic cecum will actually go into the right iliac fossa. That is the ultimate location of the cecum there. So let us just try register that one here. So what is the result of third rotation? The result of third rotation is that the midline cecum, the cecum which was in the midline, will now become like subhepatic or subpyloric cecum. Subhepatic or subpyloric cecum because of the 90 degrees rotation. That is the third rotation. Now further what is going to happen from the subhepatic region, the cecum will actually go into the right iliac fossa. And how is it going into that right iliac fossa? By differential growth of the abdominal wall. Differential growth of the abdominal wall. So everything I have shown you practically in the video there. It is just we are writing the notes. And if you just simply read from the textbook or simply write on the notes, you will not be able to understand that. So it requires that practical thing, how exactly the rotation is taking place. Now if you add all of them right now, 90 degrees, 90 degrees and 90 degrees, totally midgut will rotate 270 degrees in anti-clockwise direction. Crystal clear concept. Now once you have understood this normal rotation of the midgut, now it is the time to learn the most important thing, that is about the anomalies. So let us see the important anomalies of the rotation of midgut. Let's see what is happening here. So in anomalies, when we are going to study about the anomalies, the first thing that I am going to teach you is about the non-rotation. Now let me tell you what is this non-rotation. And the good thing here is that I have explained you so clearly, I have told you so clearly that now I'd request you to apply that. I'll just tell you what's happening in non-rotation, then I want you to apply already before I tell you or I teach you, I want you to apply. Now in non-rotation, what is going to happen? Okay, what is happening in non-rotation here? First thing is that the first rotation is normal. First rotation is normal. I mean to say, first 90 degrees in the anti-clockwise direction is normal. But what is going to happen here? The second and third rotation will not occur. Okay, second and third rotation will not occur. They will not at all occur. Okay, so what is going to happen once the midgut herniates out? You have got that prearterial segment and the postarterial segment. Now they will undergo the first 90 degrees rotation, and due to that first 90 degrees rotation, what is going to happen? Prearterial segment towards the right and the postarterial segment towards the left. That means a small intestine towards the right and large intestine towards the left. That's all. The second and the third rotation will not at all occur, and simply that midgut will again reduce back into the abdomen. So how will be the condition in the abdomen right now? In this anomaly, that is non-rotation, how will be the condition? All the loops of the small intestine will be lying towards the right and all the large intestine will be lying towards the. Let me show you one beautiful picture here. Yes, look at this diagram here. Now in this diagram you can clearly observe here, like small intestine, all the loops of that are lying only on one side, whereas large intestine, all the loops are lying on the other side. The moment you see this picture, definitely it should get in your mind already, okay, yes, this one is nothing but non-rotation. So in non-rotation, only first rotation will take place, second and third will not occur. So it's a classical picture of non-rotation of midgut. So again the same thing, I made you write down like what's happening in the non-rotation. Now because of this, what is the result? Let us see what is the result right now. How to identify, that's important. So because of this non-rotation, all the small intestine, it's towards the right, and all the loops of the large intestine will be towards the left. Perfect. And this is extremely important for you to remember. So that's the final thing, like image based questions will be asked, and that is the thing you have to remember. In the exam, if they give you the small intestine towards the right, large intestine towards the left, that's nothing but non-rotation. So non-rotation is easily understood. Now welcome to the second anomaly that we have to remember here, that is a reverse rotation. A reverse rotation. Now again the same thing guys, what is happening in the reverse rotation? Let me tell you first of all. In reverse rotation, the first rotation will be normal. The first rotation is normal. Okay. But whereas what is going to happen, the second and third rotation will occur. 90 degrees and 90 degrees, like 180 degrees, second and third rotation will occur. It's not like it's not occurring, it will occur. But the second and third rotation will occur in clockwise direction. That's the catch here. That's the catching point here. First rotation is occurring normally 90 degrees in anti-clockwise, but second and third rotation will occur. It will occur, but in clockwise direction. So try to recall in your mind what is going to happen then. First rotation is normal, 90 degrees anti-clockwise, pre-arterial segment towards the right, small intestine towards the right, and then post-arterial segment, that is large intestine towards the left. Perfect till here. Now further what should happen? The pre-arterial segment should further rotate 90 degrees anti-clockwise and even return back first into the abdomen, followed by or overlapped by the post-arterial segment. But what is happening in this one, reverse rotation, is that it is rotating in clockwise direction. So because of clockwise rotation, what is going to happen? Large intestine will return back into the abdomen first, followed by small intestine. That's the reason why the small intestine will be actually overlapping the large intestine. Look at that beautiful picture, another picture towards your screen here. So now in this you can clearly observe there the small intestine is the one which is overlapping the large intestine, and that is something abnormal. Okay, that's the thing. The moment you look at this picture, definitely it is an example, or it is nothing but a reverse rotation. First rotation is occurring normally, but the second and third rotation will occur, but in the clockwise direction. And not only the small intestine is overlapping, you can even appreciate one more thing here. Even the superior mesenteric artery, you can see superior mesenteric artery is also overlapping the transverse colon, and most of the time that is the reason, that is the one which is actually obstructing the transverse colon there. That artery, superior mesenteric artery, is going to obstruct the transverse colon. So both small intestine and the superior mesenteric artery are overlapping the large intestine. If you see this picture, definitely it is reverse rotation. So again we are going to write down the notes in the same manner. Once we have understood what is reverse rotation, now let us write down what is the result of that. Like how is the final picture? How will you be able to see that? So in this you have to remember small intestine and superior mesenteric artery. Okay, small intestine and superior mesenteric artery overlaps the transverse colon. Overlaps the transverse colon. That's the thing which will be helping you to identify this condition in the exams. That's about the reverse rotation. Now welcome to the third and the final one that you have to remember, that is malrotation. Now what is malrotation? Malrotation is a little bit easier for us to understand. Again the same thing I'll be doing. I'll just tell you what is the condition here, and I want you to already get the picture in your mind. In malrotation, what is going to happen? The first and second rotation is normal. First and second rotation is normal, and third rotation will not occur. Third rotation will not occur. I hope you're already getting the picture in your mind. So the first rotation is normal, 90 degrees anti-clockwise, pre-arterial towards the right, post-arterial towards the left. Second rotation is also normal. The pre-arterial segment returns back into the abdomen, overlapped by the post-arterial segment. And the important thing I told you, midline cecum. The cecum will be in the midline. Till here, perfect. But the third rotation, that midline cecum going into the subhepatic region and from there into the right iliac fossa, that is not taking place. So therefore, how to identify? Very easy to identify this one here. There will be a midline cecum. So what is the anomaly here? What is the result? How are you going to identify this one? With midline cecum. Midline cecum. You will be easily able to identify with the help of that midline cecum in the malrotation. So first rotation will take place normally, second rotation will also take place normally, but the third rotation will not at all occur, and that is the reason why the cecum will be lying in the midline only, easy to identify. and that midline cecum will be attached with a band, and that band is said to be the lat band. Lat band, okay. I hope you have come across that one frequently. So that is how I want you to remember conceptually the three important anomalies related with the rotation of midgut. One is malrotation, another one is the reverse rotation, another one is the non-rotation. Apart from that, I told you already about the difference between the omphalocele and the gastroschisis. That is very simple. Physiological hernia is occurring, but it is unable to reduce back omphalocele, and if there is a defect in the anterior abdominal wall, there is nothing but gastroschisis. So in this manner, we are done with the foregut and the midgut, and now we are going to see about the hindgut along with the urogenital system, guys. Thank you.